There's no getting around it. We're a fat nation. 1/3 of Americans are not just overweight, but obese. And this year, 200,000 people will resort to bariatric surgery. But those considering it need to know it takes more than an operation to win the weight loss game. Ask anyone who's struggled with obesity, and you'll hear different stories with the same ending.
After 25 years of being obese, the body has its toll. So I get my aches and pains, feel like an old man. When I hit 40, the diabetes showed up.
My legs were so swollen that if I just hit up against anything, just tapped it on the door or the wall, my skin would just burst open.
It happens so gradually that eventually you're just extremely overweight, you're morbidly obese, and you look back and say, like, when did this happen?
According to the CDC, nearly 64 million Americans are obese. A person is morbidly obese when they weigh twice what's considered normal for their height or are 100 pounds above their ideal weight.
We're treating conditions like diabetes, high blood pressure, heart disease, sleep apnea.
Anywhere from about 10 to 17 years are deducted from your lifespan simply by having a weight of this magnitude.
And I tried every diet in the book and nothing ever worked.
Bariatric surgery is often the last hope, but it's a decision that cannot be made lightly.
There are risks involved, there is an operation, and that it is a long-term commitment.
A recent study by the National Institutes of Health found the surgery itself is relatively safe, but patients must consider long-term complications like ulcers, hernias, and the effects of vitamin deficiency. Then there's the lifestyle adjustment.
You have to be willing to go to classes. You have to be willing to take vitamin supplements. You have to be willing to go to the doctor for follow-up as a lifelong patient.
Most patients lose weight rapidly for the first 18 to 24 months.
The difference is a 52 pants compared to a 40. The difference is going to any store and being able to buy an X large shirt instead of a 3X or 4X.
At his heaviest, Paul Martin weighed 376 pounds.
I still have a little bit of the tummy.
After surgery 3 years ago, he lost 150 pounds, but then he started gaining again.
232 was my tiniest. I went back up to 270.
Over time, the connection between little stomach and the intestine gets a little bit bigger. And what we're able to do is cinch up that area. It's a lot like making pleats in a skirt.
Doctors at Stanford University Hospital did a tune-up procedure. They went in through Paul's mouth and down his throat without an abdominal incision.
It's just kind of tightening things back up.
It again restricts the amount of food Paul can eat, so he's losing the weight he put back on. Paul's story brings up an important point.
This is not just about an operation. It's about a whole lifestyle change for the patient.
Without behavior modification, everyone who has bariatric surgery not only runs the risk inherent in surgery, but the risk of regaining weight.
I think the support group is extremely important.
Like this one that takes place every week at Florida Hospital, where bariatric buddies share the gift of camaraderie.
It's so important to be able to talk to other people who are going through exactly the same thing.
I had one bad day.
Support groups allow members to reveal their struggles.
You still have head hunger. No matter what anybody tells you, your head still tells you you still want to eat that piece of cake or you still want to eat those cookies.
And share success.
Before, I would have sat in the car and let everybody else walk around, but I walked back and forth and back and forth and back and forth.
Patients who attend support groups lose more weight and maintain better average weight loss than those that don't.
But not everyone can make it to a meeting every week.
Just between work and caring for an elderly parent, it just didn't work.
That's where online groups can help.
I could do it at any time, and there was always somebody on there 24/7 that could help you out. But I liked it because it was any time I needed it.
Online support groups offer one form of help. So do sites that allow patients to track progress.
Here I've clicked on strawberries, and you can do quantity, add it to the log.
They can log in their weight, log in food journaling, and if they use those types of websites regularly, they tend to be more successful than not.
I can put in there what I'm eating, how much I'm eating, when I'm eating, and track my exercise.
Two-way sites also allow doctors to check in on patients and offer positive feedback.
On this image on the computer, you could see that the before image is the darker shaded gray area, And the flesh tone is the current body surface area so that patients can see how their body's changing.
While the path for every patient is different, each will tell you finding the right route is a step-by-step process.
You gotta go. Give me a big kiss. I love you, honey.
And that they do better knowing they aren't in it alone.
Okay.